Happy Friday again, Mystic Warriors. Luna popping in. I hope you're making it a great day. Sidebar, I hope you've also remembered to take your meds to hydrate and to use sunscreen or any additional or alternative form of UV protection that you deem necessary. My go-to is a UV umbrella. I am awake after getting a few hours of shut-eye, and it really was few because the children were up not long after I started dozing off. And my grandson was having some kind of meltdown apparently, and he's a screecher. He's one of those, and it's just like, okay, Jalen's awake, sweet baby. I wanted to call him and say, hey, come see, but come to BB, but I really didn't feel like it. I wanted to get as many winks of sleep as I possibly could, and I got a few, so I guess you take what you can get at this point. Prednisone is a very challenging medication to be on because although it helps in so many ways to reduce inflammation, it's an inflammation reducer. It's so very toxic and hard on your body that it can do permanent and long-term damage to your joints. I know several ADA warriors who take prednisone or have taken prednisone for long periods of time, and they have ended up with joint replacement. And I have recently been diagnosed with avascular necrosis, which is a form of tissue death and is directly associated with prednisone use, but is also associated with one of the autoimmune diagnoses, my main autoimmune diagnosis, which is Sjogren's syndrome, that affects your joints, your salivary glands, and your tear ducts, making it my eyes feel really gritty and itchy a lot of the times if I don't have my drops. Even if I do have my drops, that's just how Sjogren's works, and it messes with your mouth. That's why I have tooth loss, because it dries out your salivary glands, and you need to have saliva in order to keep your teeth moist, in order to keep them healthy and strong. And my mouth is super dry, and my teeth cracked. They just literally started cracking years ago and breaking off, and we had no idea why. It took me years before I was diagnosed with Sjogren's, but I was symptomatic for well over 20 years. Because that's when my teeth first started cracking. And the dentist will always say, this doesn't look right, this doesn't look right. And he wasn't versed or skilled enough in Sjogren's to diagnose it at that time. But I've been struggling with it for a long amount of time. But the most visible effects of Sjogren's syndrome for me is my tooth loss. And I can't even tell you how long it took me to feel comfortable and confident enough to talk about my teeth loss. I was so embarrassed and ashamed when I started losing teeth because, that's your presentation. That's where people first see you. They see your smile. And it's so many of us who are out here whose dental issues are a direct result of medical and health issues. And there needs to be an integration in insurance that will cover dental care as well as vision. Now, I have Medicare Advantage I have Medicare Advantage, and I have but it covers my vision because vision deterioration is directly associated to Sjogren's syndrome. So why isn't dental? They still won't cover dental. So that's one of the big things that on my agenda as far as advocacy is bringing awareness and getting medical coverage for our dental issues, because they are a direct result of our physical. Did I say mental? Y'all know what I mean. I used to do all the covering of my mouth and talk. Honey, I can't do all that. It's not my fault. It's nothing that I did. It's the disease, and the insurance just won't cover it. And in my case, they said I should snatch all my teeth out and get dentures. But girl is not going to put her teeth in a cup. I don't see that in my future. So I have to wait until I have the money to get the full dentures with the 4 screws. So they'll be permanently in my mouth, and they just have to be adjusted, because along with Sjogren's and autoimmune diseases and lupus comes bone loss. So it's highly recommended by real, true lupus oral professionals that you do not get, what's those things called when they drill all into your teeth? Y'all know I got brain fog. I haven't been sleeping. What's it called? That big root canal. Root canal. My from the Lupus Foundation of America. I'm not throwing this off the top of my head. Google Lupus Foundation of America Oral Health. They did a whole seminar, a webinar on it. And he says you're wasting your money because you're going to continue to have bone loss, and they're just taking your money from you. It's pointless at this point. He said even implants, especially the individual ones, he said you're going to lose more bone mass, so you're just going to keep spending money, and it'll be cheaper to get full mouth implants or dentures, or the denture implants with the 1, 2, 3, 4. He said that's it, not all those bunch of screws and all, because your mouth is still adjusting. I hope that makes sense. But back to prednisone and the avascular necrosis, which is tissue death. I am headed in the path of hip replacement. I'm actually going through that process now. But again, mine is more directly associated to Sjogren's syndrome than it is to the prednisone. But it could very well be a combination, because I was on a very high dose of prednisone once I went into my very first lupus flare in 2016. I was on 120 milligrams a day of prednisone, 60 in the morning, 60 in the night. I don't think I slept for a year. It was insane. I got so fat, my eyes were like sunk back in my face. All my hair fell out. That's when I first lost my hair. So I had locks down here. I had shaved hair. It was cool. But anyway, it is what it is. You know, what can you do? Life happens. Life goes on until it doesn't. So I actually have an MRI schedule. I tried to get that while I was in the hospital. They wasn't going for it. For my hips, to see how far the disease has progressed, and whether or not I'm going to need to have a hip and or knee replacement. And one of the reasons why I declined the prednisone or the steroids when I was in the hospital was for 2 reasons. One is because it exacerbated the pain in the necrosis pain, and it started to really hurt my hip. And at one point, I couldn't even sit down. I had to just stand up because it affected my sciatica from my knee to my hip, down the bottom of my thigh, back to my knee. The whole area was just insane. And that was just reason 1. Reason 2, this is a little embarrassing, but when they gave me that steroid injection, which was not prednisone, which was supposed to be less harsh, I had a really startling reaction to it. And trigger warning, it felt like something was biting my booty hole and my cooch and under my armpit. And nobody could figure out what it was until they switched me from observation to inpatient. And that inpatient doctor said she had seen that effect on people when she was working in Dubai. And what she learned to do was to push the medication in a whole lot slower. And the reaction was much less. And it was. It went from me, I'm not taking it because it hurts, it's setting my soul on fire, to, okay, it went from a 10 pain receiving the medication to a 4. I can do that. And that's how I survived this long with this chest aspiration, big long word they call it, acute bronchial asphyxiation, and you know, doctors and all. I had a severe asthma attack. But that's my chat for right now, guys. The video's getting kind of long, so I'm going to cut it here. ask away any questions. If you guys have issues with prednisone, you really, really, really need to follow up and educate yourself on medications that you take. I only took it because I wouldn't have gotten any better without it. My lungs were just contracted and they needed the release. So I did what I needed to do to survive. So peace, love, and blessings, y'all. Luna out.